have so many comments of people that seem to think that this bill is just working in isolation to take certain people off of Medicaid and like that's it. So beyond eligibility, because like, okay, let's just take that out of the equation. This is affecting massive amounts of funding, state funding, federal funding, all of the funding. It goes in and limits how states can even get funding. So states right now can take a certain amount of money and the feds will match it. They're saying we're no longer doing that. Go find your own money. Medicaid programs are run through the state. So then what's going to happen is that they're going to start cutting provider reimbursement rates probably, or like reimbursement rates that are going out to facilities, which means that these facilities will no longer be able to staff them or operate. Entities like hospitals will still be expected to give care to people who are uninsured, not able to pay their hospital bills, which again means that they will need to cut down on providers. We have higher wait times, and then we are going to be having hospitals taking on massive deficits, which will close them. Especially in cases of smaller clinics, they're just going to close because they can't sustain that. The reimbursement rates for providers will go down. And just to be clear, this is not my prerogative because I don't receive Medicaid dollars. I have a private practice. We just don't. So what happens is that these facilities, community mental health centers, places where people are getting medications, rural clinics, rural hospitals that were receiving these extra dollars to kind of make up for the deficits of like, we can't operate on what Medicaid pays everyone else. So they're going to give us a little bit of like a boost just to make sure we're sustaining and fulfilling the fact that like there are no other healthcare facilities here. That's gone. These places won't be staffed. These places are just going to shut down. They're already operating at like very, very low budgets. And like, I've been in, community mental health for like a long time. And I've seen the layoffs and I've seen what the budgets do. I've seen the block grants. I've seen like how devastating that is to try to maintain staffing. And like, they're already like working people like cows to try to just see as many people as you can. We got to stay open. I don't even know what that's going to look like. It's just going to look fucking bad. It's just going to look like closure.